Welcome to our 23rd CRWDP webinar. How the presentation will run is that first I'll introduce our speaker, Sally Lindsay. Then Sally will present on her research. And following that, we'll have a Q&A. For the webinar, before we dive into things, also just a comment, we're always kind of looking for future ideas for webinars. So if you happen to want to present, it doesn't necessarily need to be research, but kind of disability and work in Canada type topics. If you are interested or you know someone who you think might be a good speaker, please do send us an email or get in touch with us somehow, because it would be great to kind of broaden the scope of how these presentations run. And before we dive in as well to Sally's work, I do want to state a land acknowledgement to both acknowledge, share gratitude, and also solidarity. And that acknowledgement is that we wish to acknowledge this land on which we live and work. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. And that acknowledgement is for where I am in Toronto, but please, understand and acknowledge the land that you are on as well, because we're online, and of course, we're not all only in one place. So today we have Dr. Sally Lindsay with us. Sally is a senior scientist and leads the Transitions and Inclusive Environment Trail Lab in the Bloorview Research Institute at Holland Bloorview Kids Rehabilitation Hospital. And Sally is also an associate professor in the Department of Occupational Science and Occupational Therapy and Rehabilitation Sciences Institute at the University of Toronto. So without further ado, Sally, take it away.
Great. Well, thanks for having me here today. I'm happy to share some of our findings from our COVID research that we've been working on. And just a quick note for people, I do have two screens going on, so I may not be always looking directly at the little green light on that's in front of me. Oops. There we go. So I know most of us are very aware of how the impact has greatly impacted all of us in terms of our health and well-being, and certainly employment. And we're all very familiar with the millions of numbers of cases and deaths. And the pandemic has had, the pandemic related measures have had an incredible impact on all of us, but some could argue that it's had an even more impact on people with disabilities, and particularly younger people with disabilities. And the pandemic has really shown a significant global economic impact in terms of unemployment, reduced hours, and financial uncertainty. So looking at COVID-19 and how this has impacted people with disabilities. So the government responses to the pandemic have revealed many gaps and differential vulnerabilities among certain groups, including younger workers, those with pre-existing medical conditions or disabilities, and people with disabilities we know are often impacted more so by economic crises compared to other groups, which can lead to further employment inequities. And some are suggesting that the post-COVID economy is expected to have an even more impact on the employment of people with disabilities. So focusing on youth and young adults is important because it's really this period of their adolescence. It's a very important stage of development that's characterized by sensitivity to social stimuli, enhanced need for peer interaction, which is really critical time of their development. And it's also when they're forming their initial work-based identities that then go on to affect their career pathways. But during the pandemic has really impacted youth's ability to work, to volunteer, and to go to school. And we're all very familiar with a lot of these, especially those of us that have kids, the disruptions in routine, the limited face-to-face social interactions, remote schooling, excessive screen time, and also the employment uncertainty about their futures. So looking at a little bit more in depth of the impact of COVID on youth's employment, We see that disadvantaged workers, such as youth and those with chronic conditions or disabilities, are really at risk of experiencing negative outcomes from the impact of COVID. So looking at some of the employment rates, and I think these were from Stats Canada from last year, so they might look a little bit slightly worse than the situation right now. But those data are saying that, so the younger group, the teenagers aged 15 to 19, really dropped. So a drop in 40% compared to those aged 20 to 34. Employment rates down 31%. And we also see that 1 in 4 youth aged 15 to 24 who were employed during the pandemic lost all or the majority of their normal working hours. And youth with chronic conditions or disabilities were more likely to report that their work situation changed from being employed prior to the pandemic to unemployed during the pandemic. So we know that youth are very vulnerable to the economic impacts of COVID because they're more likely than adults to hold temporary, non-unionized casual positions and often work in industries that are considered to be high risk, especially during the pandemic, in terms of catching the virus. So they're working in areas such as retail, food services, hospitality, healthcare, typically things that you can't do from home. So this is really putting them at risk of catching the virus. And unemployment and social exclusion for people with disabilities, this could really impact them as well if they feel that their health might be compromised if they had to put themselves at risk. And they're sometimes more likely to work in precarious positions with less job security and protections than workers without disabilities. And youth with disabilities may also encounter more challenges because their typical vocational supports and resources were reduced or canceled during the pandemic. So most of the research on pandemic-related impact on employment has focused mostly on adults, and especially those without disabilities. And we don't know that much about the barriers to school and work transitions among youth and young adults with disabilities during the pandemic. Understanding their perspectives is important because youth with disabilities often encounter many challenges in finding and maintaining employment in normal non-pandemic times, let alone add in all the complexities of the pandemic. So exploring their perspectives can help shed light on areas where youth may need further support and also important lessons learned among those who have worked and gone to school during this time. So our objective of this research was to understand the barriers to school and work transitions for youth and young adults with and without disabilities during the pandemic. So we used a qualitative design involving in-depth interviews that were conducted remotely because we weren't allowed to do them face-to-face. And we used, our analysis was guided by an interpretive descriptive methodology. And so it was a qualitative comparative design where half of our sample was had a disability and half did not. So in terms of our data collection, so the majority of our interviews were conducted over Zoom video interviews, and a few people chose to do them over phone. And the majority of our sample was from the Greater Toronto area, which, as we know, is considered a hot zone for cases and COVID deaths. We then transcribed and recorded and transcribed our interviews and had several researchers that were involved in the analysis. So taking a look at our sample. So we included youth that were aged 15 to 29. So half of them, approximately half of them had a disability, half did not. And the sample with disabilities, they had a slightly higher mean age than the youth without disabilities. And just looking at some of the demographics, so we can see that more of the youth without disabilities were working and in school, and more of the youth with disabilities in our sample were unemployed. So the Orange is the youth with disabilities, and the yellow is youth without disabilities. So our findings highlighted several similarities and some differences between youth with and without disabilities regarding the barriers to school and work transitions during COVID. So some of our key themes that came out were difficult transition to working from home, uncertainty about employment, and missed career development opportunities. So in looking here, we can see that slightly more of the youth with disabilities reported challenges with transitioning to online school and working from home, which include expenses of setting up a home office, technical challenges, and also the impact on mental health. And it seemed a particularly difficult transition for those who had nothing to do, and more so for youth with disabilities. So especially those who weren't in school, they weren't working, and they weren't volunteering, because they really had described that boredom, when they were bored, it could really impact their mental health. And we also noticed that those who had pre-existing mental health conditions, that these seem to have been even more impacted during the pandemic. So some youth reported that the cost of setting up a home office really affected their ability to work from home, and especially having a sufficient internet access. So one youth that didn't have a disability explained, not everyone may have a computer, not everyone may even have access to the internet. And another youth that did have a disability and worked part-time explained, the internet's a lot of money. Don't rely on using one person's own personal internet for them to get their job done. Don't let that be a barrier for the people you hire, somebody that happens to be privileged to have high-speed internet. And then there was a similar example in the second box below, where one person was saying, I don't even have enough space in my apartment to work from home. I don't have Wi-Fi. I didn't have Wi-Fi before the pandemic, and now I'm having to pay $90 a month for Wi-Fi. I had to buy webcams, which are expensive. I had to buy a monitor. I had to buy a desk and a chair. And we heard that quite often, because also these are younger people who, if they are living on their own, their first apartment, these are a lot of really added costs for them. So in looking at more aspects of what created a difficult transition to working from home, slightly more of the youth without a disability mentioned that technical challenges, so delays in communication, slow internet, and lack of appropriate technology prevented them from participating fully in school or in work. So for example, a young woman with a disability shared, a lot of technical difficulties came out because the online courses were new for a lot of professors. And then another person in the example on the slide here was who this person worked, and they were sharing some of their experiences. Debriefing after brainstorming over a project is a lot harder to do. You have to do it all online and set it up. And I think that creativity-wise, it's a little bit more jarring to do online. You don't really have the same brainstorming feeling of bouncing ideas back and forth, because it's hard to tell when someone wants to talk, and it can be a bit awkward. So more of the youth with disabilities reported that the transition of being home all day really impacted their mental health. And this was mainly, what we saw was mainly a result of boredom and social isolation. So some youth experienced mental health related challenges, some of which arose during the pandemic, while for others with pre-existing mental health conditions found that their condition was exacerbated due to the pandemic related stress. And here were some examples shared here. So one person with a disability shared, in terms of mental health, I don't think that was considered. So a lot of extra projects would be dumped on us, but we weren't really able to communicate what was really happening because we weren't seeing our employer in the building. And then another person said, constantly have the idea of fear. There was a lot of anxiety at the beginning in the fear of the unknown. And with this whole virus, no one knew what to expect. And I'm looking at uncertainty about employment. All youth in our study expressed that they had a lot of uncertainty about employment. And both groups of youth encountered difficulties in finding employment, and mainly due to the lack of jobs. So for youth without disabilities, challenges with finding employment was often a result of so we collected our data last summer, early fall. A lot of their challenges were a result of their summer job being canceled or reduced hours, whereas for youth with disabilities, they often had additional difficulties because of lack of job searching skills and other disability related challenges. So, and those who worked on site, so in person at their workplace during the pandemic, often reported difficult working conditions. So youth with disabilities sometimes reported that they couldn't either disclose their condition or receive workplace accommodations. So here we see that more of the youth without disabilities describe the stress of layoffs, reduced hours, and job loss during the pandemic. So for example, a woman with a disability who was working full-time explained for a little while there were concerns about having to shut down areas and laying off staff. And meanwhile, others worried about the stability of their job. So one person who worked part-time in retail said, at the beginning, when the store shut down, everyone was told to apply for employment insurance. They were trying not to let me go, but because we all didn't know how long this was going to last. And then looking at the area of difficult working conditions. So youth with and without disabilities describe challenges regarding working conditions during the pandemic, which included worrying about catching the virus, risks of returning to in-person, and lack of employer support for mental health. A main challenge in working in person was the risk of catching the virus. And some youth with disabilities really felt that they had no other option but to quit their job because they worked in an industry that was considered high risk for them catching it. And some examples here really highlight that. So in the second bottom one, I really wanted to highlight because this was a young woman who had a disability, and she worked in a high-risk sector, so in a long-term care home, and she was denied workplace accommodation. So she had a breathing condition that was kind of episodic, and it happened to have flared up during the COVID times, which was really unfortunate for her. And she basically asked her employer if she could be able to not wear a mask, but they wouldn't let her. And she ended up having to quit her job because she just felt like she had no other option. And then in looking at the difficulty in finding work. So most of the youth without disabilities reported challenges finding employment during the pandemic, and specifically a lack of jobs and a lack of job searching skills. So youth with and without disability expressed their frustration over the lack of available jobs during the pandemic, and especially ones that could be done from home. So many youth also talked about difficulties looking for work and how and where to look for work. And some youth with disabilities also mentioned their lack of job searching skills. So for example, one person shared, it's more challenging just because there's probably less out there, but there's a bit of mixed confusion happening. I don't have a lot of experience job hunting. So usually the first opportunity that's come up, I've accepted it. And looking at canceled jobs and lack of opportunities to work from home. So more of the youth without a disability describe how their job was canceled during the pandemic. So typical summer jobs that youth were employed in, such as camp counselors and swim instructors, were all mostly canceled, and making the remaining few jobs very competitive and also risky for catching the virus. So the things that were available were like grocery stores or working in healthcare, sometimes like as a screener. So for example, a youth with a disability explained her experience. So right before the pandemic, I had started as a summer research position. It was a great opportunity. I was really excited but because of COVID, they had to cancel it. And then other people talked about how in their line of work that they were doing, it just working from home wasn't even an option for them. And many youth with disabilities disclosed additional challenges and obstacles that they encountered in finding employment during the pandemic, especially job searching skills, perceived discrimination, and risks of catching the virus. So for example, a woman with a disability explained, it's been really hard for anyone to find work, but it's been doubly hard for people with disabilities to find work, even during the COVID times. People with disabilities struggle. And I feel now, given COVID, it's only been made harder to find work. And then those who also had certain conditions leading them to have a compromised immune system, explain how their disability affected their ability to take on a job during the pandemic. And another key theme that came up was the missed career development opportunities for young people. So the majority of youth really described this. I think most of our sample had described, and they were worried about the longer term impacts for their career pathways. So things like canceled or reduced placements and internships, lack of volunteer opportunities, uncertainty about their career pathways, and the longer term impact for their careers. So in looking here, slightly more of the youth with disabilities describe the impact of the pandemic on their school placements or internships, and specifically fewer opportunities to learn their essential skills for their career pathways, fewer networking and professional development opportunities. And I think if you take a look at this first example in the top box is one that really captures it the best. It was a nursing student who was saying, like, you can read about how to put an IV in someone, but you really need the practical skills of practicing it in person. It's not the same thing. And in the second one, a lot of people were talking about how they felt their education was really watered down. And then looking at also a lack of volunteer opportunities. I'm a real advocate for volunteering and especially how it helps people on their career pathways. So a lot of the youth, both those with and without disabilities, shared their disappointment with the lack of volunteer opportunities, which they really felt affected their ability to develop these early employment skills, practical skills, and also building a professional network. And some high school youth, they're required to have their 40 hours. They were really worried about how are they going to complete these hours? They don't have any opportunities to complete them. And some youth really were disappointed that their volunteer positions were canceled, because a lot of people really get something of value out of volunteering, and they did find that impacted their mental health as well. So I'm looking also at missed career development opportunities, and specifically more of the youth with disabilities describe uncertainties about their career pathways. And some youth with disabilities reported that they struggled with their career, what their career pathway was in general, whereas youth without disabilities often reflected more on how it would impact their career pathway. So to sum up, we found several similarities and some differences for youth with and without disabilities regarding barriers to school work transitions during the COVID pandemic. And youth with disabilities may need additional supports especially working remotely, and also in helping them to find meaningful and accessible vocational activities that align with their interests. And just looking at some implications. So I think that clinicians should consider how they can help to foster youth engagement in meaningful, accessible activities such as employment or volunteering, and especially ones that they could do remotely, working from home or online volunteer positions. And I think we need to help youth with pre-existing mental health conditions. And they may need additional supports during the pandemic, and also their return to the new normal, and helping to foster their well-being. And clinicians in vocational rehab need to provide support and resources on helping young people to develop their career pathways. And then just to acknowledge our funders, this was a sub-study of a larger CHR partnership grant. I'm happy to take any questions that people may have.
Great. Thanks so much for the really interesting and also just like relevant presentation to our current times and what's going on. We do already have 2 questions, so I'll get to those, but just in case, if anyone came later, the Q&A function is where you can ask questions, and you can also ask questions in the chat, and then I will state those to Sally. So our first question here comes from Shano Brown. They said, were more youth without disabilities reporting difficult working conditions because they were more likely to be employed?
So I think, if I could recall that one, I think it was youth without disabilities. And yeah, that was the case because more of them, yeah, that's right, more of them were working. So that's why more of them were reporting the difficult working conditions.
Yeah, okay. And then from Anik Labonte, sorry if I missed the info, were the disabilities of the participants invisible or visible? If both.
Yeah, I just realized that I didn't have that in the demographics. So we always try to capture ones that we see at our hospital. So we were inclusive of physical, visible disabilities, invisible disabilities, like the whole spectrum. So some mental health, some autism, cerebral palsy, all the typical ones that we see at our hospital. So quite a wide range, and certainly that does play a factor into things too, because everyone had quite different abilities.
And I guess the follow-up point that they had there was to ask if there were any differences in the types of barriers specifically that those individuals met in finding their work process.
Yeah, that's a great question. So I guess in looking, we didn't look at that specifically, but just things that come to mind. So some of the people that had a mental health condition, or if it was a comorbid condition with another one, they did really express that they had a lot more difficult time adjusting to the pandemic, and it really impacting their mental health and depression. And I'm trying to think, so some of the people who had more like severe physical disabilities, I think it impacted them in a different way, in that they just chose not to work and to risk catching the virus.
The next question is one that was actually also on my mind, which is, what advice do you have for employers given these research findings?
Yeah, so I think I've been reading a little bit about this as well, of how what can we learn from the pandemic moving forward. I think we have seen that people can work from home successfully, and I think that might allow for a lot of great potential opportunities for people with disabilities, especially those who have more accessibility issues, or in terms of even just getting to work through navigating transportation. Like if we can have more work from home options for people with disabilities, I think that would really open things up for them in terms of employment.
Our next question is, were you able to discern the extent to which participants were inclined to or able to adhere to COVID guidelines outside of employment?
Outside of employment. So we did ask about all the COVID health and safety protocols in terms of their workplace. And a lot of them, for the most part, said it was pretty good, except for a couple of people where their employer wouldn't provide accommodations. But you mean outside of, do they mean outside of workplace in general, like in terms of going out in public?
Well, so there's a follow-up to this that might add clarity that reads, if so, did relative attitudes and approaches to COVID safety impact participant responses?
Yeah, it's a good question. I don't know if we really asked about about that specifically, but I think for the most part, like youth with and without disabilities both seem to be pretty panicked about catching it, and seem like they were very cautious about wanting to wear a mask or avoid going on public transit and those kinds of things. Mind you, we also have to think about the time when we collected the data, which was a year ago, we've learned a lot since then, and people have kind of had it with the pandemic right now. So
do you think that responses might be different if the survey was conducted now with a year's more process built in?
Absolutely. Yeah, so definitely. So certainly I think the employment situation is different now compared to a year ago. Everything really shut down. There seems to be a little bit more hope right now. Most people have vaccines in their arm, and things are hopefully opening up soon, and jobs opening up again. So I think it would be a completely different result if we ran our interviews today.
Yeah. And our next question, I'm not sure if I'm reading it correctly, so I'll ask a question that I think is being stated, but please type back if I didn't get this correctly to the person asking the question. To Sally, while you were interviewing people, did they get jobs following internships?
I'm trying to recall. I don't think any of them had, like at the time that we were doing the interviews, I think they were still in their placement, so we don't know if they did. But it was certainly something they were very concerned about, because at that time, there weren't even opportunities to do in-person placements. So it was something they were certainly very worried about.
And did you notice any differences in responses based on like the industry or the type of occupation that the individuals were working in or interested in?
Yeah, I'm afraid I didn't have that slide. I should have added that in. But certainly, yeah, there were, so the people who were working, it was mostly in what we would call like the high risk sectors, like the grocery stores, or they were in healthcare, screener at a hospital, those kinds of things. And I'm trying to, I think there were a few people that were lucky enough to work from home, which was quite a different situation for them as well. So certainly, yeah, there were certainly differences in terms of where people were working and the type of employment and obviously their experience, their employment experiences during COVID.
Great. And I wonder as well, I know the focus here was on the barriers, but were there any discussions about what certain organizations might have been doing right, or what people felt that they did well to help themselves kind of navigate the complexity and the trouble of this period?
Yeah, so there were, and I should have had a slide about that too. There were certainly, we do have another separate presentation about all of the good things and the positive stuff that came out. I think a lot of the people certainly demonstrated resilience during these times as well. So it does seem like an overwhelming negative presentation, but it was focusing more on the barriers. And I think a lot of the youth talked a little bit about both, like some of the challenges that they had, but then they would also talk about how they overcame them. And it was sort of a bit of a back and forth depending on which stage, of the pandemic that we interviewed people in. So certainly very complex of what time it was at.
And our next question here begins with: the pandemic has normalized large portions of the population being out of work or underemployed. What are your thoughts about the social impact of COVID on the perception of work?
Oh, that's a great question. Yeah, that's a really tough question. I think, I think it is something that has constantly, like, the notion of how we think about work and employment and unemployment has really constantly shifted over the course of this pandemic, whether that be that, is working from home the new normal, or, our youth now expected. Is it okay for them to not be employed because there's not jobs out there? Or should we still expect our youth to look for jobs? It's a great question. It's something I think that we need to think a little bit deeper about, and it will certainly continue to change as we, return back to school and work in the fall.
Mm-hmm. And there's a follow-up question to this that I find really interesting as well, that reads: did respondents with disabilities mention anything about feeling seen or better understood because the general population has now experienced the type of workforce barriers
Yeah.
that they've been accustomed to for a long time?
Yeah. So we do, in one of our other presentations out of this data, we do have some great examples of that, where youth with disabilities who didn't really adjust well to working from home, because they're like, I'm already all set up. I've got my technology. I know what I need, my accessibility stuff. And we do have another example of someone, I don't remember if it was a communication disorder or what kind of disability they had, but they did feel like they were kind of more included, and could communicate with their other coworkers better, because the Zoom and other meetings now have the closed caption so that they could hear and people could hear them. So people are starting to realize a lot more of the accessibility features, or that we should be having these in most meetings for people, and being more inclusive.
Great. And then our next question, clearly people are really interested in this research, is where can we access the full report?
Yeah, I'm happy to. So this current presentation is currently under review, but once it's accepted, I'm happy to share a copy of that. And there are more positive findings of how people cope. That one's already published, and I'm happy to share the link if people want to email me for a copy.
Great. Yeah, and just so everyone's aware too, not the report, but the presentation, we will post on the CRWDP website in case you missed any part of this specific presentation. Our next question is: would love to hear best advice for government youth employment programs to best support youth with disabilities to develop skills and gain meaningful employment.
So one of the things that the youth were telling us, and one of the things that really helped them to cope, that they said from a government perspective, was can't remember what the acronym stands for now, the CRB and the CSB funding. So that helps support students and people who are out of work. But one of the things that they did tell us, they're like, the money's great, it takes a bit of the pressure off, but they wanted more help with, like, how do they find employment? Like some people really felt stuck, like, okay, oh wow, that's so competitive right now, but they didn't even know how to get started with how to find a job. So I think I think we need more of that, and it should be more accessible. What we've learned, I think, is that a lot of these trainings and job training opportunities should be online, like especially for young people with disabilities. They can't always get out if a place is open. It's sometimes difficult for them to get out. So yeah, certainly more opportunities are accessible. And people really wanted to know how they could find online volunteer opportunities as well, which can help them to build a resume to get a job.
Thanks. A follow-up to part of this presentation. So I know that the comparison was persons with and without disability and that transition experience. I'm wondering, because you've got such an amazing kind of background in just the youth experience of having a disability and then seeking work, what are the main differences in terms of barriers and perhaps also facilitators too for youth with disabilities before and during the pandemic?
So I would say the main challenges for youth with disabilities before the pandemic are usually things like accessible employment is a big one. And then along with that, organizing your transportation to the job and discriminatory attitudes and stigma that a lot of people experience. So that would be in normal times. So in COVID times, I think, well, at least for the people who were employed, they liked that working from home, the people who did, because they felt that there wasn't that stigma as much. And some of them also talked about how they didn't need to worry about disclosing their disability, which they really liked, or asking for accommodations because they were already set up at home. I don't know if I answered the full question.
Yeah, no, you did well. Our next question is a really big one, but it's, how do we work with government to approve more funding for persons with disabilities?
That's a really good question. Well, I think it would be certainly important to involve people, young people, and a variety of people with different types of disabilities, learn from their lived experiences and have them have their say about that.
And the next question really in a lot of ways brings up questions of intersectionality, which is a really meaningful question. Did this study include or target peoples that identified as Indigenous?
I don't recall that we had, no one identified as being Indigenous in this sample that I can recall. No, but that would be certainly a great future direction to vote. And actually we've just conducted a review on the impact of race and ethnicity on school to work transitions for people with disabilities, and hope to follow that up because it's such an important area.
Are there any like preliminary findings or thoughts from that research that you might be willing to share?
Yeah, so certainly like people who are from, we've learned that people who are from ethnic minority backgrounds they're really understudied. For one thing, certainly from a Canadian perspective, most of the research is American. And two, the employment rates and school completion rates for ethnic minority youth with a disability are just so much more worse compared to those without. And I think there's so much work that needs to be done in learning from their lived experiences.
We've got a few people over time that I haven't commented on yet, but who are just saying thank you for doing this research and thank you and so on. So our next question is, did participants self-identify as having a disability, or did they have to meet a certain criteria set out by the researchers?
No, that was a self-identified.
Okay. And currently, we don't have any questions that are live at the moment, but we'll wait and see if some come up. While waiting, just out of curiosity with this work, what are kind of like the next steps for it?
So yeah, so as I mentioned, we have just completed a review on the impact of race and ethnicity on youth with disabilities, and specifically in school and work. So now we're hoping to follow that up with more research, and probably with a qualitative component, and understanding people's lived experiences from yeah, and it'd be great to have some Indigenous youth as well, and looking at different perspectives. I think that's one of the challenges I see in this work, is a lot of people tend to view people with disabilities as one homogeneous group, and there's so many differences that we need to unravel.
Yeah, no, it's a very important point. I know I see that in my research as well. So given that we don't have any questions remaining, we'll wrap off the webinar here, unless Sally, there are some kind of last points that you want to make regarding this work or
I
otherwise.
don't think so, not for me.
Okay, great. Well, thank you so much for presenting. This was a really well-attended webinar, and I think a very important topic as well. So before we go, I do also want to say thank you to Sabrina Imam and Kathy Padkapaeva, who helped make all of this possible. If you are interested in future webinars, we should be having another webinar late next month. You can take a look at the CRWDP website. There are lots of ways to learn about the webinars there. There's a news and events bubble, a webinar bubble. We have our monthly newsletter that goes out via email, and as well on the webinars page, you will find all of our past webinars with recordings and often PDFs of slides as well. And we'll hopefully soon have this webinar online too, so you can see it again if you're interested. So yeah, thank you so much, Sally, and we'll end things there. Have a great day, everyone.
Thank you.
Bye-bye.
Bye.